Today we will be talking about prevention of head and neck cancers.
What is head and neck cancer? It's cancer of the head and neck, including cancer originating in the following areas: oral cavity, pharynx, larynx, the paranasal sinuses and nasal cavity, and the salivary glands.
Oral cavity includes the lips, the anterior two-thirds of the tongue, the gums, the inside lining of the cheeks and lips, the bottom of the mouth underneath the tongue, the hard palate, and a small area of the gum behind the wisdom teeth.
The pharynx is a hollow tube approximately 5 inches long that starts behind the nose and leads to the esophagus. The pharynx is broken into three parts: the nasopharynx, the oropharynx, and the hypopharynx.
The larynx is also called the voice box. It's a short passageway formed by cartilage just below the pharynx in the neck. It contains the vocal cords and it has a small piece of tissue called the epiglottis, which moves to cover the larynx to prevent aspiration.
The paranasal sinuses are the small hollow spaces in the bones of the head surrounding the nose. The nasal cavity are the hollow space inside the nose.
Salivary glands produce saliva, and it's the major glands on the floor of the mouth near the jawbone.
How common is head and neck cancer? Head and neck cancer accounts for approximately 3% of all cancers in the U.S. This cancer is twice as common among men than they are amongst women, and they are diagnosed more often among people over the age of 50 than they are among younger people.
Prevention of head and neck cancers. Prevention consists of any actions and lifestyle changes that an individual makes as a conscious effort to lower their chances of getting cancer. In an effort to prevent the chances of developing head and neck cancer, it is advised that patients avoid consumption of certain substances as well as to change certain aspects of their lifestyle.
Tobacco usage is the leading cause of head and neck cancer. This includes cigarettes, pipes, cigars, chewing tobacco. They all can cause oral cancer. Tobacco is most likely to cause cancer in the floor of the mouth. Tobacco users who have had oral cancer may develop secondary cancers in the oral cavity, nose, throat, vocal cords, esophagus, and trachea.
The number of alcoholic drinks consumed per day increases an individual's risk of oral cancer, and risk of cancer is higher for individuals who use both alcohol and tobacco.
Being infected with HPV type 16 increases the risk of head and neck cancer. Those who have many sexual partners have a higher risk of obtaining an HPV infection, which can lead to cancer. Common early symptoms of HPV include white or red patches seen in the mouth, any unhealed ulcerations that have also not healed after 3 to 4 weeks, and any abnormal outward growing tissue.
Occupational exposure to wood dust is a risk factor for nasopharyngeal cancer. Industrial exposures, including exposures to asbestos and synthetic fibers, have been associated with cancer of the larynx. People working in certain jobs in the construction, metal, textile, ceramic, logging, and food industries may have an increased risk of cancer of the larynx. Industrial exposures to wood or nickel dust or formaldehyde is a risk factor for cancers of the paranasal sinuses and nasal cavity.
Other risk factors for head and neck cancer include sun exposure, exposure to radiation, and poor oral hygiene.
Quitting smoking reduces an individual's chances of developing head and neck cancer by 50% within 5 years of quitting. And within 10 years of an individual quitting smoking, the risk of developing head and neck cancer is the same as a person who never smoked. Educating individuals on the dangers of risk factors such as tobacco use, alcohol use, and HPV viruses all are protective factors.